The internet is full of bro science, fake knowledge, half information, or propaganda. Your quest of reliable, authentic health information ends here. So subscribe this channel and hit the bell icon, and you never have to go anywhere else ever again.
Hello everyone, how are you today? I am Dr. Paramjeet and you're watching Doctor Education. Today we are going to talk about dry mouth. Yes, saliva or spit is basically made by your salivary glands present inside your mouth, and they are important to keep your mouth healthy. They basically break down the food products, they wash away food particles from your teeth and gum, as well as help you in swallowing. And saliva also contains some minerals like calcium and phosphates, which are helpful to keep your teeth strong and even fight tooth decay. And dry mouth happens when you do not have enough amount of this very saliva to keep the mouth wet, right? So dry mouth is also called xerostomia in medical language, and this can actually happen to literally anyone and actually happens to everyone occasionally, right? For example, when you are nervous, when you are stressed, you can face this dry mouth. However, if you have persistent dry mouth, it can make chewing, swallowing and even talking difficult, right? So dry mouth also can increase the chances and risk of tooth problems, fungal infections in the mouth, and it can, because saliva can even help keep the germs in the mouth under check, right? So dry mouth is not normal, and it is not a normal part of aging. So if you think you have dry mouth because of aging, you are wrong. So you don't forget to see your dentist or your doctor to find out why you have dry mouth. Let's see what are the most common reasons for dry mouth. Number one is medicines. Yes, side effects of some of the medicines, like they can blood pressure medicines, depression medicines, bladder control medicines, these can cause dry mouth. Then some diseases like diabetes, there is some HIV AIDS or Sjogren's syndrome, these can lead to dry mouth. Exposure to radiations like during cancer treatment can lead to dry mouth. Chemotherapy can lead to dry mouth, and even some nerve damage or injuries to the neck or head can lead to damage to these nerves, which basically supply to salivary glands, and therefore you don't have enough saliva production. So all these things can lead to dry mouth, and even some vitamin deficiency can lead to dry mouth. Then if you do have dry mouth, what will happen? There will be a sticky dry feeling in the mouth, there will be trouble chewing, swallowing, and even you will not feel that much amount of taste, or even you will have trouble speaking, right? You can have burning feeling inside the mouth, you can have cracked lips, then you can have sores or ulcers in the mouth, in the tongue, infections can happen, bad breath can happen, right? So a doctor will basically assess your medical history and then suggest you some blood tests accordingly to diagnose medical conditions, and treatment obviously depends upon what is causing your problem, right? If medicines is the cause of your dry mouth, then the doctor may change the medicine or adjust the dosage so that you can have less of this problem. Even you can get a prescription of saliva substitute to actually counterbalance if those medicines are needed. Same thing, there are also some self-care steps which you can take for dry mouth. Like the most important, number one is drinking plenty of water. So if you drink a lot of water, then most of the times dry mouth goes away permanently, right? If you have a habit of that. Second thing you can do is chewing sugarless gum, avoiding tobacco and alcohol. So this is good. Good oral care hygiene at home is also very important, and even regular dental visits are important to take care of this, to prevent it. So some more things which you can do is, number one, if you already have dry mouth, then number one, start sipping water or sugarless drinks, right? Because you don't want to take a lot of sugars and get fat. So sipping a lot of water, sugarless drinks, And then during meals also you should sip water instead of drinking it. Sip it slowly, and this will also improve the taste of your food as well as help you in swallowing. Then avoid drinking a lot of caffeine, coffee, tea or soda, because caffeine can also make your mouth dry. Obviously that also adds up into the reasons. Then chewing sugarless gum can actually stimulate your saliva production, right? Citrus, cinnamon or mint flavored candies are also good choice, right? And you need to avoid salty food, spicy food, which can cause pain or in a dry mouth if you are putting them inside. Obviously you need to avoid tobacco and alcohol, they can dry your mouth. And you need to use a humidifier at night in your room, because if you actually sleep with a open mouth, it can lead to dryness. So all these things are steps which you can take to prevent and treat dry mouth. Obviously diagnosis, the main core problem is very important, whether it's a disease, it's a medicine or a nerve damage or vitamin deficiency, right? So that's like B12, vitamin B12 deficiency can lead to dry mouth, and even vitamin C deficiency can lead to gum problems. So that's why you need to find out what is lacking in your diet and fulfill that. So this is all about dry mouth. I hope this video was helpful. Don't forget to share, subscribe and hit the like button, and I'll see you next time, same place. I'm Dr. Paramjit, you're watching Doctor Education. Stay connected, stay healthy.